So in this presentation, I'll be taking a look at what is abnormal and what is deemed normal. There are four main definitions of abnormality. Individuals may fall under one or all of these categories. There is statistical infrequency, deviation from the social norms, failure to function adequately, and deviation from ideal mental health. Statistical infrequency is a method of evaluating behaviour using mathematics. If we were to take IQ as an indicator for how intelligent a person is, this would be an example of statistical infrequency. If you fall in the mean average, you would be normal. Any deviation would indicate you're abnormal. Strengths or weaknesses of statistical infrequency. Weaknesses of the approach that it fails to recognise good behaviours. Have an extremely large IQ means you are not normal. Away from IQ, where if we look at statistical frequency from a cultural point of view, some cultures may have different norms in life. In Japanese culture, it's abnormal to have tattoos. Gang members and criminals wear tattoos. In the UK, 1 in 3 have a tattoo. This demonstrates how unreliable and cultural reliant statistical definitions of normality are. Deviation from social norms is another definition of abnormality. It suggests that deviation from social norms is another definition of abnormality. It suggests that conduct that deviates from social norms is abnormal. For instance, if you were to queue, is considered socially acceptable. It would be considered abnormal behaviour if someone skipped the queue and went directly to the front. This definition of abnormality depends on the society in which the activity takes place. Social standards vary widely through cultures. What is considered strange in one culture may not be strange in another culture. If we look at Tourette's, it would be considered a deviation from social norms. It is not normal to have outbursts. When we look at strengths or weaknesses, it distinguishes from normal. It gives a clear definition of what normal behaviour is and it isn't. Weaknesses, it can be seen as subjective. Social norms are based on opinions within society. They can be weaponised to control people, groups of people, as a threat to social order. They also change over time. What once may have been a social norm may be abnormal by modern standards and vice versa. Homosexuality until 2014, same-sex couples could not marry. It was legalised in 1967, and in 1835 the last executions took place. Failure to function adequately. The definition means it implies a person is incapable to manage the demands of daily life. A failure to carry out daily activities including self-care, working, engaging in meaningful interactions, and communicating effectively is seen as abnormal. Studies in 1989 defined the ability to function or cope into 7 sections: personal distress, maladaptive behaviour, unpredictability, irrationality, observer discomfort, violations of moral standards, and unconventionality. A psychological disorder that would fall into this category could be depression. The level of depression may vary on how many of the features this person meets. A depressed person may still be able to maintain employment and manage a family. Again, strengths and weaknesses. The definition concentrates on individuals' observative behaviours, enabling others to determine whether the person exhibits normal behaviour or abnormal behaviour. Using the list gives professionals useful checklists to evaluate behaviour. The list outlines specific criteria for when people may need help. Weaknesses. Different cultures have different stance on what normal daily life is. What in one culture may be deemed normal may be abnormal in another country. There is too much focus on this as an indication as well. Abnormal behaviours may not be an issue for the individual, but it may be for people around them. If a person's acting abnormally, they may not see a problem. When you look at deviations from ideal mental health, it's another definition. By shifting the spotlight from solely on mental illness, the concept of ideal mental health becomes more optimistic. What is considered normal or ideal mental health is the focus of this definition. A person's behaviour is considered abnormal if it does not conform to this theoretical theory of normality. In 1958, there was a proposal that if someone has ideal mental health, they should exhibit the following 6 traits. Positive attitudes towards oneself, autonomy, integration, accurate perception, environmental mastery. Strengths and weaknesses. If we look at the weaknesses first, this idea attempts to take mental health in the same way as you would take physical health. Mental health is very, very subjective. A broken arm is a broken arm. A mental illness, like I said, it is subjective. It doesn't take into consideration, again, how things change over time. Some behaviours were considered normal once a time. It was considered a deep sign of religious commitment when a person saw visions of God. Nowadays, you're more likely to get a personality disorder or schizophrenia. When you look at the strengths, the guidelines provide, or Marie's proposal there, exhibiting the 6 traits, are very good for professionals. This definition places more emphasis on desired behaviours and good behaviours rather than negative. There are a few problems with diagnosis: validity, reliability, and bias in classification, including gender, social class, and ethnicity. A problem is simply defined as something that makes something difficult. That's from Cambridge. Psychological experts reach diagnosis by using a certain method to ascertain what an individual's problem may be. Physical methods may include behavioural observation using rating scales, clinical interview, such as verbal assessments, psychological tests such as an IQ, and tests using specialist equipment such as an MRI scanner that can scan the brain. Sources that make diagnosis a lot easier would be, there's a couple of manuals: the Diagnostic and Statistical Manual of Mental Disorders and the International Classification of Diseases. They contain descriptions and symptoms of mental health disorders. When we're looking at the validity and reliability, reliability refers to the consistency of diagnosis. A classification system needs to make the same diagnosis each time in order to be considered reliable. Therefore, when evaluating a patient, various psychologists ought to come to the same conclusion. The degree of which we measure is known as validity. When dealing with such a condition as schizophrenia, we must take into account the diagnostic instruments used. For instance, do many diagnostic methods arrive at the same diagnosis? There was a study in 1973 about schizophrenia. 8 people acting as patients visited 12 hospitals complaining of hearing voices. All of them were placed on wards. Staff diagnosed 11 individuals with schizophrenia and 1 case of manic depression. Conclusion to that is psychiatric staff cannot always differentiate sanity from insanity. diagnosis methods like the one used in this experiment have made errors in diagnosis and therefore aren't valid. A solution would be inter-rater reliability. Is a good way to overcome issues with reliability. Is a degree that we use separate observers who rank, code, evaluate the same conditions. The most simple way is to use a percentage agreement. Simply 2 or more psychologists score an individual and figure out what it relates to, what psychological disorder it relates to. When we consider gender, the bias associated with gender can be seen in many examples. Antisocial and historic personality disorder have been linked to gender bias. Historic disorder is linked to dramatic and excessively emotional conduct. Antisocial personality disorder is marked by violent and impulsive. In the instance of the historic personality disorder, favoured by females, as it is seen as emotional. The antisocial personality disorder for men, although some women may be presented as violent and impulsive, this could be looked at a way of her acting emotionally. Ethnicity, cultural ethnic bias within psychology is shown by the disproportionate amount of people from different ethnic groups, such as black, being diagnosed. Statistics from a government-led census in 2005 discovered that black males are 3 times more likely to be admitted to a psychiatric ward. In 2010, another census reiterated the fact that the number of people from black and Asian groups are more likely to be diagnosed. And the number of black men diagnosed with schizophrenia, as previously discussed, schizophrenia is sometimes misdiagnosed. The stigma attached to mental illness is that it can cause serious problems, combined with the perception of dangerousness of black males. Many black males can be misdiagnosed. When we look at social class, the assumption that people from different social classes, especially those from lower social classes, are more frequently diagnosed with severe disorders such as schizophrenia and antisocial personality disorder. Pressure associated to social class has a wide range of negative impacts on mental health. Damaged relationships, low self-esteem, shame, despair, anxiety, anger, depression, trouble sleeping, substance abuse, homelessness, and even suicidal thoughts or acts. However, bias held by professionals regarding social class of individuals have been observed to affect the willingness to cooperate with a client, recommending treatments, diagnosis, and judgments regarding risk and violence. There are many factors that can lead to misdiagnosis or problems with diagnosing psychological disorders. A majority are fueled by human error. This can either be a biased view on sex, race, class, among how some professionals may judge a case. As mentioned, validity and reliability of diagnosis. If 2 experts disagree over a particular case, they can't come to a diagnosis.